Today we'll discuss on the spinal cord, the structure of the spinal cord, what all are included under the spinal cord. So the spinal cord is a elongated, almost cylindrical part of the central nervous system. So it is an elongated. It goes along our vertebra, right, which is suspended in the vertebral cord, surrounded by the meninges and the CSF. So like in the brain, also CSF is flowing. In the spinal cord also CSF is flowing, and it is covered by the meninges. The spinal cord is continuous above with the medulla oblongata. So we have learned in the brainstem, the medulla oblongata is the last part. Then after the medulla oblongata, it is continuous with the spinal cord, and this spinal cord extends from the upper border of the atlas to the lower border of the first lumbar vertebra, okay, till the first lumbar vertebra it will continue. It is approximately 45 centimeters long in adult males and about the thickness of the little finger. Nerves conveying impulses from the brain to the various organs and tissues descend through the spinal cord. So the spinal cord are carrying all the nerves from the brain, and they are through the nerves, through the nerve branches from the spinal cord, they will supply to the other parts of our body. At the appropriate level, they lift the cord and pass to the structure they apply. Similarly, sensory nerves from organs and tissues enter and pass upwards in the spinal cord to the brain. Okay, so from the level, the spinal cord has different levels. Okay, the cervical level, thoracic level, lumbar level, sacral level. Okay, so all these levels will supply to their appropriate. Then the spinal cord is composed of the gray matter and the white matter. So under the gray matter, this gray matter, the arrangement of this gray matter in the spinal cord will resemble the shape of the letter H, having two posterior, two anterior, and two lateral columns. So let us first see how this is posterior column of the gray matter is. The posterior column of the gray matter is composed of cell bodies that are stimulated by the sensory impulses from the periphery of the body. The nerve fibers of these cells contribute to the formation of the white matter of the cord and transmit the sensory impulses outwards to the brain. So this posterior column of the gray matter is responsible for the sensory. Then the anterior column is doing the motor functions. Okay, so in the section of the spinal cord showing the nerve root, we can see the middle middle red portion area, darkened area is known as a gray column, is the gray column. Then the peripheral area is the white column. So it is divided into posterior and anterior. Okay, so in the gray column also it is divided into anterior and posterior. White column also divided into anterior and posterior. So there is the anterior nerve root and the posterior nerve root. So the posterior nerve root will be responsible for the sensory, and anterior nerve root will be the responsible for the motor. Then in the white matter also it is composed of the posterior, anterior, and lateral. These tracts are formed by sensory nerve fibers ascending to the brain, motor nerve fiber descending from the brain, and fibers to the connector neuron. The tracts are named according to their points of the origin and destination. Example, the spinothalamic and corticospinal. So next we will see the sensory nerve pathway. We have earlier we have learned the motor nerve pathway. So this sensory nerve pathway, in this sensory nerve pathway, the opposite will happen. In the motor nerve pathway, from the brain it will go to the respective muscles of that area, of a particular area of our body. But in this sensory, from the sensory receptor in the skin, like from the in the sensory we will sense whether we are having any pain, proprioception, temperature, pressure, etc. So all these are carried by the sensory nerve. So the sensory receptor in the skin, they will receive the impulse, and it will go to the posterior root ganglion. From the posterior root ganglion, it will come to the spinal cord. From the spinal cord, it will go to the medulla oblongata. From the medulla oblongata, it will go to the opposite side. That means the sensory decussation will be there. The nerve fiber will go to the opposite side. From the skin, it is coming from our right side of the body, but at the level of the medulla, it will cross to the other side of our brain, and it will reach the other side of our brain. That is, it will reach the left side of our brain. So like this, the sensory nerve impulses are carried.